From basketball to baseball, track, and cross country, for 17-year-old Winston Clark, he's involved in sports year round. But that changed when he injured his ankle during a pickup basketball game just over a year and a half ago.
I was like, Mom, you got to come check this out. And there's this big lump on the side of my ankle.
Initially, when I saw him, there was some concern of an ankle fracture on x-ray. We kind of went over it with him. Didn't think it was a fracture, more of just a pretty severe ankle sprain. Ankle sprains are graded on a system, and the more ligaments you injure on the lateral side of the ankle, the worse it gets.
After rest and rehab for about 8 weeks, Winston returned to sports, this time track and field.
I just got done running the 4x8, and I had to go high jump, and they're like kind of stressing me to get there, me and another kid that had ran the 4x8. So I jumped before him, and my ankle just rolled over, and that was that.
MRI was ordered at that time and showed instability and tear of all three of his ligaments on the outside of his ankle, as well as concern of injury to his syndesmosis.
That injury would need to be repaired surgically.
There's two parts to that repair. There's the internal bracing part of the repair that involves repairing what's called the anterior talofibular ligament, which is the ligament in your ankle and foot that helps resist that inversion or rolling of your ankle. In a normal ankle sprain, that's the main ligament that resists that. And then also repair of the syndesmosis, which we actually run. It's a suture tightrope across the ankle joint to help support that.
Just over a year ago, sophomore Mackenzie Jorgensen found herself in a similar situation. She injured her ankle at a soccer tournament.
I rolled my ankle and it hurt a bit and got really swollen, but it kind of went away and came back during track.
Well, Mackenzie had a history of chronic sprains or multiple sprains, and she came to me after about her third or fourth in 1 year's time. And that's not uncommon. Many people kind of have 1 or 2 ankle sprains, and after 1 or 2 ankle sprains, they get this repetitive type loosening of the joint, and they're susceptible to sprains over and over and over.
Mackenzie wanted to get back to playing sports quickly, so she opted for surgical repair of her ankle.
Surgery is essentially taking a look at the ankle joint through a scope, cleaning the ankle joint out, removing any scar tissue that has formed because of the instability. And then we do a very small incision on the outside part of the ankle, and we construct 1 or 2 ligaments, depending on what the MRI says is torn. In her case, 2 ligaments were torn, so we retensioned those ligaments, and we used a special technique called a check rein to get her back onto the field quickly.
Both doctors say ankle sprains are not uncommon, and if you continue to injure your ankle, surgery is often an option to get you back to being active.
There's about 25,000 ankle sprains that occur in the United States per day. And people don't realize that about 1 in 3, or 33%, will heal with problems. And the most common problem is that the ligament doesn't heal with enough tension, or it's loose.
If he continues to have discomfort and pain through physical therapy, through bracing, taping, if those things do not help, then it's best to get it surgically fixed to decrease the chance of reoccurrence.
So whether it's the soccer field or the basketball court, these high school athletes are ready to get back to the sports they love.
I could definitely tell it was different, but I mean, after a while, it really was fine.
Well, I scored 2 goals with my ankle.